Welcome to the Medical Excellence Center. Today's lesson is about understanding shock, signs and symptoms, and we will use the TV SPARC cube model. Introduction. Shock is a critical condition that requires immediate medical attention. It occurs when the body is not getting enough blood flow, which can cause multiple organs to fail. Recognizing the signs and symptoms of shock can be crucial in emergency situations. The TV SPARC cube model is a mnemonic that helps in remembering these symptoms efficiently. This lesson will explore each component of this model. T. Thirst. Thirst is often one of the first symptoms of shock. It indicates that the body's fluids are not balancing correctly. When in shock, blood volume can decrease and cause an intense feeling of thirst as the body tries to maintain adequate fluid levels. Recognizing an unusual level of thirst can be a prompt to check for other signs of shock, especially in trauma situations or in severe dehydration. V. Vomiting. Vomiting may occur in shock, particularly if it is induced by pain, severe stress, or toxins in the body. It's a reflex reaction to something wrong in the body which could be directly related to digestive upset or a signal from the brain responding to other distress signals. Continuous or severe vomiting needs urgent medical attention as it can further lead to dehydration, worsening the shock state. S. Sweating. Sweating is another symptom indicative of shock, particularly cold sweat. This type of sweating happens without physical or ambient thermal reasons but rather as a physiological response to stress or pain. The skin might also appear pale and clammy. This reaction is part of the body's fight or flight response, meant to regulate body temperature and fluid balance under stress. P. Pulse. Weak pulse. A weak and sometimes rapid pulse is a common sign of certain types of shock, such as hypovolemic or cardiogenic shock. The heart struggles to pump blood effectively, making the pulse feel feeble or hard to detect. Monitoring pulse strength and rate is crucial in assessing the state of shock. A. Anxious. Anxiety or agitation is a non-specific but common symptom in many patients experiencing shock. The state of unease can be due to the brain receiving less oxygen and nutrients needed, leading the patient to feel an impending sense of doom or severe nervousness. R. Respirations shallow, rapid. Rapid and shallow breathing can be observed in shock cases, particularly where oxygen levels are compromised. This type of breathing may be an effort to increase oxygen uptake and combat the decreasing circulating blood volume and pressure. C. Cool, clammy skin. Cool, clammy skin is often seen in shock, regardless of the underlying cause. The skin may feel cool to the touch due to reduced blood flow to the skin as the body diverts more blood to vital organs like the brain and heart. C. Cyanotic. Cyanosis refers to a bluish or purplish color of the skin, particularly around the lips, fingers, and toes. This occurs because of insufficient oxygen in the bloodstream, a severe sign that the body's tissues are not receiving enough oxygen. U. Unconscious. Loss of consciousness can occur in severe cases of shock. This is a life-threatening condition and requires immediate action. Unconsciousness happens when the brain does not receive enough oxygen or glucose, which are essential for maintaining brain function. B. Breathing difficulties. Although not part of the original mnemonic, breathing difficulties often accompany shock. This could range from breathlessness to the complete inability to breathe. Immediate intervention is crucial to manage airway and breathing. E. Eyes, blank stare. Another extension of the TV SPARC cube model could include symptoms related to the eyes, such as a blank stare, dilated pupils, or lack of responsiveness. This may indicate severe brain hypoxia or decreased brain function due to shock. Understanding and remembering these signs using the TV SPARC cube model can aid in quick identification and response to shock, potentially saving lives. Each symptom should be evaluated in the context of other observable signs and medical history for accurate assessment and intervention. Thank you for learning. Join and save a life with us at the Medical Excellence Center.